Today is Tuesday, February 9th, 2021. My name is Diane Mihalik. I am the Chief Marketing and Corporate Communications Officer for Munson Healthcare, and I'll be your moderator for today's session. Next slide, please. As a reminder, we have been doing these press conferences virtually since the end of December to keep you updated on vaccine rollout throughout northern Michigan. But I wanted to take a moment to just remind you of some other ways that you can stay updated on the latest news related to COVID-19 and vaccinations. Munson Healthcare has a bi-weekly newsletter that we send out via email. You can sign up for that at munsonhealthcare.org/newsletter. You can also follow us on Facebook, LinkedIn, Instagram, Twitter, and YouTube. And at any time, you can visit us at munsonhealthcare.org. We have a whole listing of COVID-19 FAQs and the latest information related to the pandemic available that gets updated regularly. Today's speakers, joining me today, we are welcoming back Dr. Christine Nefsey, who's the Chief Medical Officer for Munson Healthcare. And also every other week, we've been trying to have representatives from the local health departments. I'm happy to say that they are back today. So we will be also joined by Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. Lisa Peacock, who's the Health Officer for the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan, and Wendy Hirschenberger, the Health Officer for the Grand Traverse County Health Department. So first, I'd like to introduce, next slide, please. First, I'd like to introduce Dr. Christine Nefsey, Chief Medical Officer for Munson Healthcare, who will provide us the latest update on the current numbers that we're seeing. Dr. Nefsey, welcome.
Thank you, Diane. So good news on the numbers front. As you can see here, our total cases are just over 24,000 for our region. The best news that we are seeing is that really over the past week or so, we have seen a steady decline in our percent positive in our community. For the last 2 days, we've been below 5%, and we have not been there since October. So it's really great news from a numbers front. Next slide. Here you can see our total inpatients, which is again down from where we've been, reflective of the cases that we see in the community. Again, good numbers. Next slide. Just a graphic representation where you can see our big uptick and a nice steady decline, which is absolutely the direction we like to be trending in. Next slide. So vaccines. We are currently in a situation where all of our vaccine supply has been allocated to those that are currently scheduled for appointments. We are not scheduling additional first dose clinics right now, and that is completely related to how much vaccine we receive from the federal and state government. However, if you have already received your first dose from Munson Healthcare, we will be providing you your second dose when you were scheduled. Next slide. As of February 9th, we have administered through Munson Healthcare over 24,000, almost 25,000 vaccines. And we are currently at just over 64% for our Munson Healthcare workers who are now immunized. This is some data from the United States. This is as of yesterday. There were 32.6 million people in the United States who have received one or both doses of the vaccine. And if you look at the bottom graphic there, you can see that is approximately 3% fully vaccinated, and certainly a small percentage, but trending where we would like to be to receive herd immunity. And then these are our numbers for the state. So over 1 million doses in the state of Michigan. I think people are aware that the governor has a goal of 50,000 a day. We are, approaching that certainly, close to 31,000 a day is nothing to sneeze at. And again, a lot of this is related to how much vaccine we receive, but we are absolutely just excited at how many people in our state have been vaccinated already, and then our part here in northern Michigan in contributing to that number.
So Dr. Nefsi, let me stop you there before we go to the next slide. I know a lot of people have had questions about why all of a sudden is Munson Healthcare or local health departments not receiving as much vaccine. And tell me if I'm wrong, but what I have heard is that, you know, when the emergency use authorization was first granted for Pfizer and Moderna, the tier 1A group was mostly made up of healthcare workers. And it's just sort of logical that many healthcare workers are, you know, reside at hospitals. And that's where a lot of the doses were being allocated. And is it because now we're moving towards the tier 1B and getting into more of the general population that the doses of vaccine are being allocated differently? Is that one of the reasons?
Yeah, I think that's absolutely right, Diane. That is absolutely part of the reason. You know, that first tier was long-term care residents, staff, and healthcare workers. So it totally made sense for hospitals to be the ones to administer that vaccine as efficiently and as close to work as possible through the hospital. As we do expand out to the general community, I think the state as well as others are looking to depend much more so on the health departments as well as some commercial pharmacies and clinics to get the vaccine out to patients, just like we would do a normal flu vaccine or anything like that.
So do we still have a ways to go with the healthcare workers and the long-term care facilities as well? You mentioned Munson Healthcare was just over 64% healthcare team vaccinated. And I know that we're still in the process of vaccinating some of those healthcare workers as well, right?
Well, yeah. So, you know, there are a couple of groups. There are those that deferred for one reason or the other, getting their vaccine when it initially came out. We've also hired new employees, and that's true across the community. So we still have some healthcare workers. You know, there are ones who are maybe less traditional. You know, they don't work for a hospital or a clinic. You know, trying to get them in with either Munson Healthcare or with the health department to get their vaccine. But we have gotten the vast majority of healthcare workers in our communities who want a vaccine vaccinated.
That's great news. All right, thank you. I'll let you finish with your presentation then.
So I'm sure most people have heard a lot about the new variants and probably have heard too that we have seen at least one of those variants, what people are calling the UK variant in the state of Michigan. So it's really important to understand. So these variants aren't necessarily more virulent than the original COVID-19 vaccine virus that we saw, but they do appear to be much more easily spread around the community. You know, there's also some question about how well some vaccines cover minor illness with those variants. We do know that the vaccines we have now are extremely effective at causing serious disease and hospitalization from those variants. But because they may be a little less effective in mild disease, and because we still have you know, less than 10% of people in the United States even partially covered with vaccine, it's especially important that we continue to stay the course as far as masking, which remember protects you and others, social distancing, avoiding those indoor gatherings with people who are out of your immediate bubble. And if you have any symptoms at all, please get tested. And if you have the opportunity, if it is your turn, please get vaccinated.
So Dr. Nefsi, do we think there's going to, do we anticipate there may be a spike in cases due to Super Bowl parties or anything like that? Is the hospital preparing for anything like that?
Yep, always preparing, always trying to look at numbers and leading measures to try to figure out where we are heading so that we can be prepared. You know, we are hoping that people stayed the course and weren't in Tampa for the Super Bowl. And so, you know, stayed within their bubble and had small gatherings, if any at all. But certainly that is a possibility that we are looking at and prepared for. And again, the variants would be another thing that we are looking at and preparing for from, you know, a state perspective.
And Dr. Nefsi, while I have your attention, there is a question that just came in from one of the reporters who's viewing this. And the question is, there seems to be a statewide push for the Michigan Department of Health and Human Services for the health departments to take more of the lead and to kind of minimize the distribution through hospitals. Is that a one-size-fits-all approach, or can Munson Healthcare still be helpful in distributing the vaccination to the general public in the future? I think that's a great question, right?
Absolutely. It's a great question. And I would say, again, it goes back to how much vaccine we get. So we will adapt to however much we get. Right now, so that we have whole teams pulled from doing other work to do these mass vaccination clinics. We would like for them eventually to get back to their regular work, but we also understand that getting vaccine distributed is extremely important and something we're very supportive of. So I think if we received a ton of vaccine, all of a sudden we would stand up and do everything that we could, along with our health departments and other retail pharmacies and anybody who has the ability to give vaccine, to do that. Right now, from a long-term perspective, with how much vaccine we're getting, we really feel the health departments doing their vaccine clinics as they are, and then our clinics distributing vaccine to their patients is the right approach. But we are adaptable and flexible and will adjust as we receive vaccine.
Great, thank you for that answer. And I think that goes to show, just within these press conferences that we do every other week with the health departments, that Munson Healthcare is fully committed. We're committed to continuing that collaboration and, again, helping out in whatever way we can, which I think is a wonderful thing. So
Absolutely.
Thanks, Dr. Nefsi. Mm-hmm. All right, so now I'd like to invite Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10, to provide an update on what she is seeing in her region. Dr. Morse, are you online?
I am. Can you hear me?
We can hear you, yes. Oh, there you are. Great. Now we can see you too. Welcome.
I can see myself. So, all right.
And just maybe we can take the slide down so we can see each other a little bit better too. I'll just ask my.
Okay.
Thank you.
Okay.
Great. Thanks.
All right. So as of last week, the 10 counties of District Health Department number 10 has given just under 22,000 vaccines. Last week, we gave 8,469. Nearly all of those were second doses. This coming week, we have vaccine clinics every day but one, including Saturday. So we have clinics 5 days of the week. Most of those are first dose clinics. So it just kind of depends what vaccines we get. And we've heard that before. In terms of variants, I just wanted to share, I did have a meeting with MDHHS this morning. I'm just looking at my notes. There have now been 45 cases of variants of the B117 variant only. We don't have any of the others. So 45 cases have been confirmed in 10 counties and the city of Detroit. So, so those numbers are going up, and probably with time that won't be news making anymore. So that variant is likely to just continue to grow and grow. So, so again, just to update people on that number. We did have some individuals miss appointments and arrive late, and we had people have to wait to accommodate people. We had the bad weather over Friday and Saturday, but we did that. But I think things are pretty much status quo for us. We just continue to adjust based on the amount of vaccine that we do receive. So I think we're getting into a bit of a groove with things.
Thanks, Dr. Morse. And just to clarify, do you currently have any openings in your scheduling, or are all of your doses also currently allocated?
I haven't heard today yet, but I'm sure that they're probably all booked. And again, with individuals that missed appointments due to the weather, I'm sure that everything's been allocated. Those appointments are usually booked within a very short period of time of when we open them up. So
Okay, great. Thank you. Thanks for that clarification. I think we're all kind of in the same boat with that right now. So great. Well, thank you for those comments. I'll have you back for the Q&A panel in just a minute. And now I'd like to introduce and welcome Lisa Peacock, who's the health officer for the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Welcome, Lisa.
Thanks, Diane. Good morning. Thanks for having me today. So yes, just like in line with what everyone else has said so far, the pandemic risk indicators are trending downward, which is something that we all welcome and we're glad for. However, we are still experiencing outbreaks in different settings, and we know that transmission is still a risk. And so we need to continue all of these mitigation measures while we strive for this goal of vaccinating 70% of our population. Our biggest limiting factor is, of course, the number of doses that we have to work with each week. And so until we get there, all of those things are going to continue to be important. Testing is widely available across the region. There are lots of different access points where people can get tested. And with the emergence of a new variant in northern Michigan, we saw the first case with that's been identified with that new variant. It's probably likely that there are many other cases that we don't know about, but it just reminds us to continue to be diligent about testing. If people have symptoms or an exposure or travel history or anything like that, they certainly need to be tested so that we can readily identify people who have COVID-19 and make sure that isolation and quarantine of close contacts can happen right away so that we can reduce transmission. We, in terms of vaccination planning at the Health Department of Northwest Michigan and Benzie-Leelanau, we are giving all of our doses every week. Certainly all of our first doses that come in, we schedule those appointments early in the week and we give them by the end of the week. The Health Department of Northwest Michigan has given a total of 7,718 total doses. Just over 6,600 of those were first doses and just over 1,000 second doses. Benzie-Leelanau has given a total of 2,782 total doses. A little over 2,100 were first doses and 648 second. We're coming up on a couple of big second dose weeks in both health department jurisdictions. This week, we are giving over 3,200 total doses in the Northwest jurisdiction. A little over 1,000 of those will be first doses and 2,252 will be second doses. So 2,252 people that will have completed their vaccination series by the end of the week. And Benzie-Leelanau will be giving just under 1,000 doses this week, 400 of those being first doses and 560 being second doses. And I think just one other thing I'd like to point out, we are monitoring the percent of our population that has received their first dose and just kind of keeping track of that, looking at each county by county so that we can make sure that we are distributing that vaccine equitably. And I'm happy to say that both the Benzie-Leelanau and the Health Department jurisdictions have 12 to 13% of residents who have received their first dose, which is keeping pace with the state that's hovering around 9.5%. So I think we're doing well here in northern Michigan. And I think a big reason for that is the partnership between our hospital, our Munson Healthcare system, and our partner health departments, all of us working together and being willing to do whatever needs to be done with whatever resources we have to keep moving forward toward this goal.
Great. Thank you, Lisa. That's a really wonderful update. Glad to hear that is happening in your areas. So in just a minute, we'll have you back as well for part of the Q&A session. As a reminder, we are taking questions. So if you are on the Zoom, you can submit them through the Q&A feature on the Zoom, or you can submit them via Facebook. And our last panelist for the day, I'd like to welcome back Wendy Hirschenberger, the health officer from the Grand Traverse County Health Department, for an update from Grand Traverse County. Wendy?
Good morning. Thank you again for having us. So similar message from Grand Traverse County, as you've heard from the other two or the three health departments and the hospital about the trends. So we're definitely seeing a significant downward trend. We're seeing numbers in cases per day that are back to October's type numbers. So, and percent positivity down around 4.5% for Grand Traverse County. So that's very welcomed news. As far as vaccination, like the others, we are administering and scheduling the week that we get the vaccine. and administering it all by the end of the week. So for last week, Grand Traverse County Health Department administered 1,185 first doses and 628 second doses. This week, we will administer roughly 850 first doses and 1,873 second doses. So through the end of yesterday, we had administered 7,148 first doses, 1,498 second doses, for a total of 8,648 total doses. And by the end of this week, we expect to have 3,128 people fully vaccinated in Grand Traverse County.
That's wonderful. Anything else you'd like to share, Wendy, before we get to the Q&A session?
Just that we're continuing to work through the priority groups, just like everybody. It's the same priority statewide, and that we have well over 20,000 people in Grand Traverse County alone who are currently eligible for the vaccination, and we get less than 1,000 doses a week. So you can imagine it's a lot of people trying to get the appointments and get vaccinated, and we appreciate how eager everybody is in Northern Michigan for that.
I agree with that. Thank you, Wendy. Now I'd like to invite all of our panelists back. I know, Wendy, you don't have the camera option, so appreciate you just hanging out by audio there as well. We are starting to receive quite a few questions that are coming in. The first one is for Dr. Nefsi. A couple of questions related to the variant. Lisa mentioned the importance of testing and the availability of testing. Can you just reiterate again, do our current tests pick up on this new variant, and do you think they'll pick up on other variants as they emerge?
That's a great question. And early on, when we started to hear about these new variants, we went to our vendors that do our testing and ensured that the current platforms we have do pick up the variant. So right now, we are in a good position as far as that goes, and have confirmed with our vendors that our testing platforms do pick up the variants.
Great. I have a couple more questions for you, Dr. Nefsi, before we move to the other speakers. The first one is, there's some confusion, or I think some rumors out there about the difference between the first dose and the second dose of the Pfizer and the Moderna vaccination. So I have heard recently that there's some people that believe that the second dose is different than the first dose, or it's more powerful than the first one. Is that, I know that's not true, but could you explain some of the science behind that, please?
Yeah. So, they're exactly the same vaccine. Whether it's the first dose or the second dose, it's the same amount, it's the same vaccine. This is not dissimilar to many other vaccines we use. So if you go back to your childhood vaccines, if you look at MMR as an example, there are 2 doses in that vaccine series.
That's measles, mumps, and rubella?
Yep, measles, mumps, and rubella. Likewise, we have things for diphtheria, tetanus, and pertussis that are 4 doses as a childhood vaccine. We require tetanus to be boosted every 10 years. So, the way that vaccines work is they really do stimulate your immune system to recognize and respond to a pathogen before it makes you ill, and then preferably before you can make others ill. So these 2 series vaccines are exactly the same. And what when Pfizer and Moderna did the studies, what they found was, in order to get that 96% use or effectiveness rate, you needed 2 doses to get that. It's about 50% after the first one. So there's no difference between the 2 vaccines. They're exactly the same one. But what the studies of those 30,000 people before this was authorized showed us was that you really need those 2 doses a certain time apart to get the max response from your immune system to be effective against the virus.
Great, because that was one of the other questions as well, is can you skip the second dose? Because I think there's a bit of confusion out there as well, as people hear that some of the new or emerging vaccines that have not been approved yet for authorization in the United States, but may be in the UK or something, like Johnson & Johnson and AstraZeneca may only have one dose. So I think there is some confusion about why that is. And, you know, if you've currently had your Pfizer or a Moderna dose, can you skip the second dose? And we don't recommend that at all, right?
We do not recommend that.
Yeah.
We recommend following, you know, whatever their recommendation is as far as dosing and spacing. There are some situations, and there have been some countries that have altered that for different reasons. We are not in that same situation, and we really are adhering to the best practice, what the studies showed, to give those vaccines as you know, presented by Pfizer and Moderna, of 2 doses weeks apart.
Great. And just one last question before we move on. Can you give us an update on what you know about Johnson & Johnson and AstraZeneca status in the US?
I know a little bit more about Johnson & Johnson. They have applied for their emergency use authorization, and the FDA, CDC, ACIP are expected to meet at the end of this month to make that evaluation and recommendation about whether they will receive their emergency use authorization or not. Right now, we expect that they will. There's been nothing that has come up that would indicate that they wouldn't receive that. So we do expect that to happen at the end of the month. The AstraZeneca one is being looked at a little bit more carefully now, as they did some testing against the South Africa variant and found that it wasn't as protective. So we are really waiting to hear on that one.
Great. Thank you, Dr. Nefsey. That's really helpful. Next, I'd like to move on to a couple of questions for Dr. Morse. The first question is, has your health department been told to reserve a certain quantity of doses for certain counties that are considered more socially vulnerable? And if not, how do you decide how to allocate doses within the counties? I know that we're all working to, you know, allocate them as equitably as possible, but I don't know if you have any comments on that question.
And one of the health officers might be better able to answer this, but I think the state tells us exactly how many doses are for each county, and they're sent to those counties specifically based on their social vulnerability index calculations. Again, I'm not as intimately involved in the allocation and distribution part of it, but does that sound right, Lisa? Okay.
Yeah, so I would just add that we are actively looking into this. We just received the formula that the state is using where they're applying the social vulnerability index score to the health department jurisdiction. So that's one step in the right direction and helps us to understand maybe where we might have some more vulnerable areas in Michigan, but we certainly can dive down deeper, and we will continue to dive down deeper. Right now, there's just such a major volume. We're trying to get the vaccine out to the eligible groups as quickly as possible and manage barriers as they're identified. And we've put some great things in place, but certainly we're doing more and more all the time to look at that.
Great, thank you, Lisa. Dr. Morse, one other question for you. Is there any probability that this virus will mutate itself out of existence? Wouldn't that be nice?
No, I think it's here to stay. I think with time, there were already 4 different coronaviruses that were part of just our normal flu season, cold season. So I think this will just join in that. I think with time, it'll be like one of those 4 where we've all had exposure to it enough that it's not as tremendously significant. You know, I think it's really hard to predict the future, but I believe it will be a bit like our flu. I think we'll get vaccinated with our current vaccines. I think this virus will likely continue to mutate. We may then have to have booster shots, so to speak. We'll have to have different vaccines, like we do have to have different flu vaccines. From what I've read, a lot of other experts believe that will be similar. But usually once a virus is here, it's here. You know, if a virus mutates such that it doesn't infect humans or it doesn't cause illness, it's an evolutionary thing. It doesn't make it, and some other variant takes over and continues to spread. So it would be nice, but I don't think that's going to happen.
Agreed. Dr. Nefsi, what do you attribute the continuous decline in case numbers? Are mitigation efforts working? Are we building up some sort of natural immunity? Or do you think vaccinations are really making a dent? Any thoughts on that?
Yeah, I do actually. I read 2 articles this morning that showed that the mask mandates actually had a huge impact on the community spread of this disease. So I think the mitigation efforts that our local and state health departments put into place have 100% been effective. And so, you know, just a shout out to our Northern Michigan community for following those and helping us as a community kind of get through this in a way that never overwhelmed our health system. You know, we've been fairly lucky. But 100%, I think that those mitigation efforts are the key. I think we're seeing the same thing with influenza. We've had virtually no cases of influenza yet. I think the same mitigation efforts, same mitigation efforts are impacting that as well. You know, and we had asked early on for people to honor those you know, rules, those mitigation rules, if you want to call them those, you know, and it has made a huge difference. So yes, I think that, you know, ultimately the natural immunity for those that are infected and the vaccine together will hopefully get us to where we need to be, but we are way under the percentage needed for that to have an impact yet.
Great, thank you, Dr. Nefsi. 2 questions for Wendy at the Grand Traverse County Health Department. The first one, Wendy, is if you are given your first dose through the Grand Traverse County Health Department, will you automatically be given your second dose there?
The short answer is yes. So we have been reassured by the state health department who receives vaccine from the CDC that we will be provided the second doses based on those first doses that we previously administered. And through our clinic, when you receive your first dose, you are automatically scheduled for your second dose. And that's again because of the efficacy that Dr. Nefsi described. So the second dose appointments are very important.
Great, thank you. And the second question for you is, how do you know that you're capturing the correct priority groups within your scheduling system?
That's a great question. So we're capturing it in a few different ways. So initially with the healthcare workers, we were directly scheduling them because they were smaller clinics at our local health department. So those were direct links being sent to that group. As we've opened it up to the mass vaccination site, as you can imagine, scheduling mass vaccination is a lot different than scheduling for, say, an individual doctor's appointment. And so our IT department is running analytics on those who get appointments. And I would say 98% or higher in the last several weeks have been those who are 65 or older. In addition, we also are capturing some of those others who qualify in that group 1B through some direct links. And then finally, we are working directly with the United Way, Area Agency on Aging, and the Commission on Aging, and they are able to direct schedule some of our most vulnerable seniors. So for instance, last Friday, we had a lot of 80 and 90-year-olds come through our clinic. It's great to see that. It's great to see people who've been homebound for so long there and happy to get their vaccinations. So that's how we know that we're capturing the right people.
Thanks, Wendy. And of course, that couldn't have come at a worse time when we get hit with a big snowstorm on top of it, but glad to hear that that's working. All right, everyone, I think we need to address an elephant in the room here because we keep getting a ton of questions sort of related to the same thing where some people are commenting on Facebook that it almost seems like we're complacent or we're happy with only getting 1,000 doses in a week, or do we think we should be getting more in Northern Michigan, and based on the state allocation. So Dr. Nefsi, I'm going to throw this one to you first, because I know that you are actively involved, and all of you are on this call with, conversations with the state and advocating for more doses in Northern Michigan and through the hospital. So can you just give us a sense of what that's like?
Yeah, absolutely. I think all of us are on meetings regularly with the state. The state is in meetings regularly with the CDC. I think there absolutely is frustration, both at the state level as well as ours, with how much vaccine we have. We know we have the capability to give a lot more. I think the state understands that as well. But there have been there's just so much vaccine to go around at this point, and a lot of people, millions and millions of people that need to be vaccinated. So I think what the state is doing is trying to allocate it as fairly as possible. So it's population based as well as risk based. So those areas of the state that were more harder hit, or have other social issues that could impact people's access to vaccine, they are sensitive to that and trying to distribute it fairly. I think that's reasonable. I'd say at the same time, they're relatively well balanced of, if you have the vaccine, get it into arms. What we don't want is, people of privilege kind of bumping their way to the front of the line. That's why we've been pretty strict about, the age requirements and those kinds of things, so we can get it to those members of our population that are the most vulnerable. I have the opportunity to talk to people from other states. I'd say, relatively speaking, and if you look at our numbers, we're doing really well as a state. Does that mean that we don't want more vaccine? Absolutely not. We would love to have, more than enough and stand up these max vaccination clinics and get thousands of people a day. And if I controlled that and was queen of the world, that's absolutely what I would do. But we have to be cognizant of equity and fairness across the state as well as nationally. We have a relatively small population here compared to downstate. So they're getting more vaccine. I mean, that's reasonable.
Thank you, Dr. Nefsi. That was some of the most common questions that we were seeing coming in, and I hope that addressed the majority of the questions that were asked through Facebook. Lisa, one more question for you. Someone through Facebook is asking, I read that you should not attempt to get an appointment outside your county of residence. Is that true, and why? And we know some people are trying to do that, and also maybe the health departments can just sort of comment on how you're dealing with that.
Great question. So different factors at play in the answer to that question. And one is that, this is a federal resource, so there is not a strict residency requirement around this resource. However, it is important for everybody to understand that allocations are being provided by the population of counties. And so, we are receiving those allocations in a population-based way. And so those resources go to the health department jurisdiction for the people that live in those counties. So I think one thing that is just natural, and we don't want to create barriers to people getting vaccinated, is that in Northern Michigan, it's very common that somebody might live in one county, work in another county. So having a strict residential restriction is not necessarily going to be helpful in creating access and allowing people to get vaccinated. But what we do want to avoid is people traveling to a county other than one they live in just so that they can get in line sooner. That is, a personal responsibility, and it has to be on, in the hands of individuals, because there's not a great way to control that across the region. So we just encourage people to look to their health department websites of the counties that they live in and look for the information about how they're able to get vaccinated. Understand that if you have barriers to being vaccinated in the county in which you live, work hours, clinic times, that kind of thing, that we aren't, turning people away. But it is certainly something that that individuals do have to take responsibility for.
Thanks, Lisa. That's a great answer to that question. I know a lot of people have been asking that, so thanks for covering that. Next, we have a couple of clinical questions for Dr. Nefsi and Dr. Morse. I'll start with Dr. Nefsi. Some people have heard about negative responses to the vaccination for those with autoimmune issues. Can you speak to this, and have you heard of this happening?
Yeah, I think this more than other vaccines got a lot of press about side effects and those kinds of things. And I think the manufacturers were very clear. The absolute contraindications were previous anaphylactic reaction to a vaccine or any of its components. Having immune problems or anything like that were not. So I would invite anybody who is eligible for the vaccine that has questions about their personal health history to reach out to their primary care physician and have that conversation. We have a lot of support for those physicians through our infectious disease providers. Additionally, the CDC has a great website, as do the manufacturers of the vaccines, but autoimmune issues are not a contraindication to getting this vaccine.
Great, thank you, Dr. Nefsi. The next question is for Dr. Morse. It's along some of the similar lines around reactions to the vaccinations. Can you speak to the anaphylactic responses some are having, and should people with that carry EpiPens get vaccinated now?
They're at higher risk for having a reaction. But if their reactions, their anaphylactic reactions are not to an ingredient in the vaccine, they can still get vaccinated. It's just recommended that they wait and be observed for at least half an hour. If there's a lot of concern, we may recommend that they get vaccinated in a healthcare facility rather than at the health department, where there might be more immediate emergent care should it be needed. But again, the only contraindication is if they've had an anaphylactic reaction to the vaccine itself or one of the ingredients. There have been studies published already at the number of anaphylactic reactions that have been reported. And in the millions of doses given in the US so far to both Moderna and Pfizer, there's been 20 to 40 anaphylactic reactions reported, and they've all responded to therapy. There's not been any fatalities at all to those. And the majority have had history of anaphylaxis or an allergic reaction in the past. So again, we take all that history, and if my nurses in the health department have any question, they call me and we consult over it. And if there's any concerns, like I said, at the most, we'll suggest they may want to get it in a healthcare facility with emergency care, right next door to them, rather than having to wait for EMS to respond. So
that's a great point. So thank you, Dr. Morse and Dr. Nefsi. And also, again, reiterating that anyone with any specific questions like that really should reach out to their primary care physician and have those conversations. So thank you. One more question for Wendy at the Grand Traverse County Health Department. Someone is asking, how do I know if I'm in line? How do I know if I'm really in line to get vaccinated? I don't know if you can answer that from your particular scheduling system and the nuances that we all have with different scheduling systems.
It's a fair question. So I would say that the online scheduling system, which is where the majority of the appointments are being scheduled. For our county, we're looking at 70,000 appointments times 2 doses, so 140,000 appointments. You will get confirmation via email if you are successful in getting an appointment for that week. If you have called the United Way Area Agency on Aging sort of mixed hotline, they are maintaining a list, and they actually are started with our initial list that we had, and so they are working their way through that list. They are working their way through sub-prioritizing based on age and vulnerability too, as well. Whether or not they have access via technology, or even if they need transportation. So the best way would be to call United Way and find out, or just keep trying every week to get one of those appointments, and just know that there's a lot of people going for the same appointments, and I know people are frustrated with that, but with the limited vaccine we get, there's not a lot we can do at this point.
Thanks, Wendy. And I can just reiterate, I'm having the same struggle with my father, who's 85 and living downstate. I still have not been able to get him an appointment. close to his home, so I don't have to take him, drive him an hour or 2 hours to get it within. It was strange how some of the scheduling was working there, but I think it's happening across the entire state. Dr. Nefsi, here's a great question. At what point will we not need to wear masks anymore? Do you have a crystal ball?
Yeah, unfortunately, I don't. I think that when we reach herd immunity, that will be probably the best time for that. It'll be interesting to see. I was having a conversation yesterday with somebody about whether we would culturally adopt some of the things we've seen in Asian countries for a long time, where if you're sick, you wear a mask. Right. We've seen such a huge impact on this, on our influenza prevalence. I'll be curious to see if there's any kind of long-term change in like culturally. But I would say, I think that when we're close to approaching that herd immunity and we start to see low community spread in our just around our northern Michigan community is when those recommendations will be made. Right now, we're not out of the woods yet. We still, are seeing cases we're unsure of the impact that the variants will have, and we have, less than 10% of our population immunized. So we're definitely not there yet.
Great, thank you. And we are out of time today. We still have a lot of really good questions coming in. So if we can bring up the slide there, thank you very much. This is the slide that has all the different resources available. And again, if you have questions and, look to your local health department's websites or phone numbers there first. You can also go to, next slide, please, munsonhealthcare.org. And we have an entire list of FAQs that we're trying to, stay on top of as we do these press conferences. So there's been a lot of questions about when we're going to receive more doses. I don't think any of us can answer that question. Very specific questions about when Meyer will get the vaccine. I don't think we know that yet, especially in northern Michigan. And just lots of different questions about specific age groups and that. So again, all of that information is available on our different websites because we're all doing things just a little bit differently still with the scheduling and the age groups. But again, we're collaborating as best we can, and we will continue to collaborate and make sure that we're taking care of northern Michigan patients and population in the most efficient and equitable manner possible. So I just want to thank all of our panelists today, especially our health department partners. I know how busy you are right now. We appreciate your time today. This webinar will be recorded and posted on our website for your future reference. And we invite you to join Munson Healthcare next week, same day and time, Tuesdays at 11 a.m. For another session and another update. So thanks everyone and have a great day.
Thank you.
Thank you.